Thank you, Colin, and welcome everybody to, I suppose, this double celebration, 21 years of the Men's Health Forum, and also the launch of the new Men's Health and Numbers report that you'll hear about later on. If I could, for just a few minutes, give you an overview of the journey of the forum over the last 21 years, and its beginnings initially in Belfast in 1999, with one of the main architects and co-founders. That would be Dr. Ian Banks, who was currently then the chair of the BMA, and a lot of his other colleagues. And in those early days, it was very much a kind of clinical focus, and a lot of GPs and nursing background and some community sectors. And actually, the only person still with it in any particular ongoing role, as you just heard from, that was Colin, and who's still working away today. There's a number of phases, I suppose, that the forum has went through, and after the initial setup, it expanded to kind of reach and to becoming an all-Ireland body with members connecting from right across the four corners of the island, and meetings held in Dublin, Belfast, and often even in the border counties in the likes of Dundalk. It kind of moved then away from a kind of medical model focused on addressing kind of chronic illnesses, and now has a more health promotion focus, including the social determinants of men's health and well-being, and the understanding also of masculinity and how that affects men's health or male health and well-being. The first seminal piece of research that the forum done was released, which was the Men's Health in Ireland Statistical Report. It was launched in Dublin next to the Dáil, and there was 150 participants at that first launch, including MLAs, TDs, health workers, and representatives from men's groups. At that time, it actually made headline news right in all the major news outlets and networks, and there was a lot of publicity from it. That took us then on the process and the journey, which is kind of where we are kind of today, where we'll offer you an update through the launch of what has been happening since. But it is important to let you know that fundamental to the forum's work is an evidence-based and informed process that allows us not only to see it as an anecdotal terms, but create research where it is missing, so we can evidence our work. And the forum is built on its success under five main powers of work, and that has been raising awareness of the health and well-being of men and boys, supporting and commissioning informed research, training men's boys' health, not just from an academic perspective, helping develop innovative projects right across the island that are evidence-based practice, and that also allow others to take that evidence and produce their own programs and evaluate and prove the worth of that evidence. And also a big part is to create networks and collaborations to advance awareness and support of men's health and well-being right throughout the island. If I can give some of the high points or standout points over the years, it has been that the forum is heavily involved with Men's Health Week promotion. In 2010, there were 90 organisations. In 2020, 150 organisations involved, with participants right across the country giving their time and their energies to developing, this really important piece of work. The forum, as part of that, provides posters for the events, a lot of social media articles, postcards, graphics, logos. You probably may have all have seen them or downloaded them from the website. And it also then has led to a wide array of activities right across the whole island, based on the goodwill and efforts of many who have identified with the need and the cause to take this forward. There's been a number of pivotal pieces of research, primarily both into young men and middle-aged men and suicide. Both action research that led to the development of an evidence-based training program that we've been delivering right throughout the country. That the forum has been a key partner to that training program, the Engage National Men's Health Training Program, and a major contributor and advisor to the National Men's Health Policy in the Republic. They've also helped to develop training and insight and highlight work with farmers and men who are isolated. They've also been currently supporting and advising the development of a Northern Ireland men's health program, and initially done with the Western Health and Social Care Trust. And then the hope would be that we would extend that throughout Northern Ireland. That program has already seen 16 trainers trained to deliver the existing Engage program. The forum continues to be actively contribute to the Healthy Ireland men's policy, and it also kind of oversees and is part of it supporting its governance and maintenance. It's currently involved also with the review and development of the gender equality strategy in Northern Ireland, and has worked closely with the Department of Health and other departments in Northern Ireland trying to advocate and develop men's health policies. Can I be clear that as a hands-on organisation, the forum is not a men's shed, or a supports provider service, or does face-to-face work, but its primarily job is to influence and promote good practices in the field of men's and boys' health work. The forum, as you may well know if you've resourced its website, has a great library of information, all of which is offered free via our information portal on our website. And you can download a number of items, particularly the man manual, which has been very successful right throughout the years, particularly in Men's Health Week. And currently, I think to date, there have been about 150,000 copies of that distributed over the years. And you also might be the recipient of the email matters, usually facilitated and sent out by Colin. And currently there's about 350, that reaches about 350 contacts each month, but also we're aware that it goes a lot further afield and people use a lot of that. So the forum's kind of constantly looking and outwards and trying to develop links even internationally, and as such as its links with the fora in the UK, Europe and beyond. It currently has been involved for a long while with the development of the Global Action on Men's Health Forum from its earliest development, and it has also been part of influencing the development of the national campaign for vaccination of boys against the human papillomavirus. It supports locally and regionally the Sheds for Life movement in the Republic of Ireland, and 4 different health forums in Northern Ireland in different trust areas. It also has worked with the students in the Dublin Institute of Technology. Sorry, forgive me, it's now been renamed and I'm not quite sure the new name, but that has helped develop students' apps and arts and our aids that can actually help and support men's health and well-being going forward. Fund has always chiefly been in the Northern Ireland from the Health and Social Care, Health and Wellbeing Department, Public Health Authority, and in the Republic by the HSE, and primarily through the National Office of Suicide Prevention. So that's a quick run over of who the forum is, and so we will get back to the birthday celebrations and the loss of report. But can I just, it's important to remind that the forum kind of works from a strength-based approach to all of its work, and doesn't see men as a problem to be solved, but rather men who should be value-validated and celebrated for who and what they are. And so can I thank you for listening? I'm now going to turn over to Colin. And Colin, as you may have already said, we will now have the short video from the Health Minister, Robin Swan, and if we could ask you please to turn your sound up that small bit, as the sound quality is a wee bit low in this. So thank you, and I'll hand over now.
I would like to thank Colin and his colleagues at the Men's Health Forum in Ireland for inviting me to say a few words. The forum has been helping to increase awareness of all aspects of the health and well-being of men and boys right across Ireland since its inception in Belfast in 1999. The forum itself turned 21 this year, and I'm delighted to participate in today's events, which quite rightly celebrates this important milestone through the launch of 2 new publications on the health of males in Ireland. The importance of men's health is an important challenge for us all. Despite the many medical and health improvement advances which have been made, life expectancy for men in Northern Ireland is on average almost 4 years shorter than it is for women. When we look at the reasons for that, it is clear to see that men suffer from much higher rates of both early and preventable death. Most conditions that lead to early death in men are linked to lifestyle, and men are also more likely to die as a result of suicide. But why is this? Well, we know that men are more likely to behave in ways which are harmful to their health. That includes a high alcohol intake, smoking, lack of exercise and a poor diet. Men also appear to be reluctant to seek help from our health services, or tend to wait until the illness has reached a critical stage. Unfortunately, this is also the case when it comes to mental health issues. In my department, the Department of Health, when developing health promoting strategies and plans, we include relevant actions targeting men or women where there is a difference in behaviours or outcomes. We have also introduced a number of initiatives in recent years, including the HPV school vaccination programme and the Northern Ireland AAA screening programme. Improving health is not just about a person's physical health. We all know how important it is to have good mental health. A person's state of mind affects every single aspect of their life. And I'm incredibly grateful for the commitment and dedication of groups like this, the Men's Health Forum, who help to improve the lives of so many people in our society, which undoubtedly brings huge health benefits. The men's health movement is growing every year. This is good news, and as a result, the lives of thousands of men and boys in Northern Ireland are being enriched and improved.
Okay, thank you for that, Colin. I would now then introduce the 2 individuals who will share the report findings. Can I first introduce Paula Devine? Paula is based at Queen's University and is co-director of ARC. ARC is a joint initiative between Queen's University and University of Ulster, which aims to increase accessibility to and use of academic data and research. Paula is the director of Northern Ireland Times Life and Time Survey, and in the past has included 2 modules on attitudes towards men. Paula has been at the centre of recording public attitudes in Northern Ireland and disseminating the findings for over 25 years. Welcome, Paula. Can I also invite Erin? Dr. Erin Early is a research assistant in the Centre of Public Health at Queen's University Belfast. She recently completed her PhD at Queen's, which examined inequalities in educational attainment in Northern Ireland, and she has broad experience in social science research, especially in the analysis of large-scale administrative data sets, and has been a field worker on several projects. So my hand over. Thank you.
Okay, thank you very much. Thank you, Michael, and thank you everybody in the Men's Health Forum. On behalf of Erin and myself, we just want to say happy birthday. Sorry we can't be with you in person, and that's nothing to do with the fact that I'm a bit partial to a bit of birthday cake, but hopefully at some point you'll be able to celebrate in person. So just want to say, give you a little bit of background and some key facts and figures from the report that we wrote. Obviously, this has been a very challenging year for everybody. We don't need to know that. Erin and I started working on this, on the report at the end of February, at the start of the pandemic. It's perhaps notable that we're launching the report this week when in Northern Ireland the vaccination programme for COVID had started. And Erin and I did not meet personally in person at any point during the report writing process. So it has been very interesting, challenging, but absolutely fascinating process in terms of producing the report and also the report card. It's a very big report. I think we've about 204 pages. There's so many facts and figures in it, so you'd be relieved that I won't be talking lots of numbers today, and I won't spoil the surprise. Given the time lag that it takes to produce statistics and to publish survey findings, most of the data actually relates to before the COVID pandemic, and that actually in itself provides us with a very useful baseline of what life was like in 2019, because we know that there are huge health, economic and social consequences of the pandemic and the lockdowns and other responses to it. So it's actually almost timely that we have this baseline of figures beforehand. So someone asked me the other day, actually it was Karen Galway, asked me what was my take-home message from writing the report. And I think I have to say that actually it's that men and boys aren't just one homogenous group. And that might seem very obvious to everybody here who obviously has an interest in male health, but actually you wouldn't really know that when you're working through policy statements, when you're looking at statistics, you're looking at survey findings, and when you're looking at service delivery as well. So I think it's really important that that our understanding of male health very much takes that multiple view. So I'm not going to go through lots of numbers. I'm going to highlight 5 numbers that I feel are important, and then I'm going to pass over to Erin, who's going to talk about some of the more process issues related to the result, to the project. That's good. It's always good to have a technical problem in the middle of your presentation. So this project was very much looking at one island. We were looking at Northern Ireland and the Republic of Ireland. So we have one island but 2 jurisdictions. And there's quite a few challenges in doing that, as you can imagine. But I suppose one feature is that even though there are 2 jurisdictions, there's only one national men's health policy, and that's in the Republic of Ireland. And that was actually the first in the world. As many of you obviously know, men's health is actually an outcome of lots of different things. It can be an outcome of biology, it can be an outcome of genetics, it can be as a result of our financial circumstances, our occupation, it can be also to do with our social networks, it can be to do with health policy, health services, and also in terms of other structural determinants as well. So men's health policies are very important in creating that jigsaw of factors that impact on men's health. So I suppose I just want to stress that that men's health within the Republic of Ireland is operating within the men's health policy and then the men framework within the Healthy Ireland strategy as well. But a very important part of men's health policies is that they can also stress the need for research and evidence in order to inform service delivery and practice initiatives. And in fact, that's something that we within ARC are very much into, making academic research and information accessible and feed into policy. And it is very important that initiatives and policies are evidence informed, and that's why this report today that we are launching provides so much vital information that provides the picture of men's health over the last 10 years across the 2 jurisdictions. But I also need to stress that sometimes when you're looking at men's health and you're looking at statistics and data, it's very negative because it goes on outcomes, and most of those outcomes are actually about death or about illness. But actually health isn't negative. Health is about health and well-being, and we need to think about the more positive things as well. So in reflection, in terms of the report, we can say yes, we can see some negative outcomes. We're talking about death rates, we're talking about mortality, cause of death, but we're also talking about causes of optimism as well. Things like increasing life expectancy and looking at the factors that help our healthy life expectancy as well. So my second number then is 2. As I say, one island, two jurisdictions. That means two healthcare systems. And I have to admit, as Northerners, both Erin and I felt a bit of a challenge trying to understand the different systems that operate both sides of the border. It also means there's two sources of data. So we have two cancer registries, and they actually provide very similar and really extensive information on different types of cancer, survival, and they were mortality rates, trends over time, and they were a major source of information for us. And there's also two statistics agency, and we very much drew upon the information from the Central Statistics Office in the Republic and NISRA in the North. So looking now at some of the figures. There are three. Cancer is the main cause of death among males across Northern Ireland and across the Republic of Ireland. And the three most diagnosed cancers are prostate cancer, colorectal cancer, and lung cancer. Prostate cancer in the Republic of Ireland is actually, the incidence rate is actually higher, the highest figure across the EU, which your initial thought is, that's a really bad figure. But actually, maybe that's a good news story. There's a very high rate of PSA testing in the Republic, and perhaps things like PSA testing and other screening programs, such as the bowel screening programs north and south, are actually the good news story, because they're able to catch and detect these particular cancers early. And as we know, early detection means a better chance of survival and a better chance of appropriate treatment. While we're saying that cancer is now the leading cause of death in both Republic of Ireland and Northern Ireland, again, the good news story, if there is a good news story, is that survival rates are getting better. So over the last 10 years, while the number of cases of people diagnosed with cancer has increased quite a lot, survival rates are increasing and mortality rates are decreasing for most cancers. There are some specific cancers where survival rates are not increasing quite so much, but the overall story is that survival rates are getting better. However, there are differences in the incidence rates and survival rates of these cancers according to different groups of people. So, for example, testicular cancer is most commonly diagnosed in men under 45 years. Incidence rates of cancers as well are often highest among those areas of deprivation, although the reverse is true in terms of testicular cancer. So again, it's not just taking one figure, but looking at the context around it in terms of age, in terms of deprivation, and in terms of occupation, in terms of screening programs, in terms of what are the health services that are available in that particular area as well. So the four leading causes of male deaths in both Northern Ireland and the Republic of Ireland are invasive cancers, circulatory system diseases, respiratory system diseases, and external causes of injury and poisoning. So cancers cause about 30% of deaths in both jurisdictions. Circulatory diseases 10 years ago was actually the #1 cause of death. And that has decreased, perhaps due to increased treatment and also to do with decreased smoking rates among males. External causes of death and poisoning, external causes of injury and poisoning account for less than 10% of deaths of males. And these include things like homicide, road traffic accidents, and suicide. So there has been a fall in the number of suicides across the island of Ireland, especially since the economic recession about 10 years ago. But it still remains a concern, especially for middle-aged men. I think we sometimes think of young men and suicide as being particularly a concern, but we need to think of the issues affecting men right across different age groups, right across different areas, and right across different social circumstances as well. And the last figure that I want to talk about is life expectancy. The report very much took a social determinants approach, and we acknowledge the relationship between the social and economic circumstances and health outcomes. And as I've been reinforcing, men are not one homogenous group, and this is very obvious when we look at life expectancy. So life expectancy is the product of many factors. So it can be to do with individual biology, individual genetics, to do with treatments for specific diseases, to do with healthier lifestyles, as well as income, wealth, and education. And life expectancy provides one of the broadest indicators of overall health in the population in general. And the good news story is that life expectancy has increased over the last 30 years, and in fact has been increasing for years long before that. But a couple of key findings still remain. Men have a lower life expectancy than females. Life expectancy for males in the Republic of Ireland is slightly higher than it is for males living in Northern Ireland. Some of the increasing life expectancy over the last few years is due to reduced mortality from circulatory disease and from cancer. As I said earlier, survival rates for cancer are getting better, and that means that life expectancy is increasing as well. But these figures mask the differences according to socioeconomic circumstances. So in 2016 in the Republic of Ireland, the life expectancy for males living in the most deprived areas was 79.4 years. And the life expectancy for men living in the least deprived areas was 5 years more than that, which is 84.4 years. So that 5-year deprivation gap is really, really important. And even within that, we find that there are differences as well. So in 2008, the All Ireland Traveller Health Study found that the life expectancy for traveller males was 61.7 years. So you can see that that's dramatically lower than others. And that was similar to the life expectancy of the general population in 1945 in the Republic of Ireland. So just very stark reminder that there is a lot of positive news, but we need to look at the differences and circumstances of different men and boys living across the Republic of Ireland and in Northern Ireland. So I'm now going to pass over to Erin, who's going to talk about some of the data issues and process issues and some of the challenges and recommendations. I'm going to continue sharing the screen. So thank you, Erin.
That's great. Thank you so much, Paula. And happy birthday as well. And thank you all for having us here. So as Paula just mentioned, I'm going to briefly outline the procedures that we followed when writing the report, problems faced, and recommendations we have moving forward. So in this report, we collated freely accessible governmental data sources and survey findings, which really allowed for a comprehensive overview of male health. We compared jurisdictions of the Republic of Ireland and Northern Ireland when possible, but there were some issues in directly comparing the data across jurisdictions and over time. And this was really due to variation in data collection and measurements in the Republic of Ireland and Northern Ireland. So for example, the European Age Standardised Rate has two versions, one from 1976 and one from 2013. So the use of these different versions made it difficult in comparing trends across time and also across jurisdictions if they used the different versions. The second example is in relation to suicide. So earlier in 2020, NISRA, which is the Northern Ireland Statistics and Research Agency, reported that they were reviewing the Northern Ireland suicide death data series between 2015 and 2018. So at present, they are recommending using the ICD-10 codes relating to self-inflicted injury only. However, the previous classification for suicide in Northern Ireland and this present recommendation from NISRA both vary from the ICD-10 codes used in the Republic of Ireland to classify suicides. So again, this is a difficulty when we're trying to compare suicide rates between the jurisdictions of the Republic of Ireland and Northern Ireland and across time. And finally, in relation to mental health and well-being, these concepts are measured in various ways, and these include the General Health Questionnaire. However, it has been reported that this questionnaire is more appropriate to females, And some other measures that we came across were also self-report, which have some limitations as it may lead to mental health and well-being being underreported. Paula, can you move to the next slide, please? Thank you. So we had some problems that we faced when writing the report, and I've outlined a few of these in this slide. So firstly, there is a lack of available data from government sources on specific conditions and illnesses. So when we were writing the report, we found it was easier to get data about deaths than it was about people living with a disease. And there was also a lack of available data on small social groups, and these included those who were homeless, homosexual, transgender, and some ethnic minority males. We did reach out to different data suppliers to gain this data, but when no data were available or provided, we were able to bridge the gap at times with survey data. However, I think it really highlighted to us the real importance of having greater research into these social groups to ensure that when we move forward, our policies and interventions are effectively targeting those in need. We also had the problem that there were gaps and inconsistencies in the way that data are disaggregated. So we found that if data were disaggregated according to key socio-demographic factors, which include gender, socioeconomic status, age, ethnicity, marital status, location, to name but a few, the list could go on, it would provide invaluable insights into male health, and it would allow us to accurately compare trends over time. However, we do recognise that data is often collected for statutory requirements, and we also need to ensure that we can't find out who individuals are through the data. Thanks, Paula. Next slide, please. So from the report then going forward, we have some key recommendations. Firstly is the greater availability of data, particularly for those health conditions, illnesses, and social groups where there is currently limited data available. Secondly, the greater disaggregation of data on an all-Ireland basis. So this would prove really beneficial to allow for the accurate comparisons of rates and trends across the Republic of Ireland and Northern Ireland over time. It would also allow a greater understanding of the male social groups that are most affected by certain illnesses. And it would also provide the opportunity to uncover a wide range of risk factors associated with poor health and well-being. The third point there relates to the need for greater exploration into the intersectionality of socio-demographic factors and their influence. So we all have multiple identities based on our gender, socioeconomic background, age, ethnicity, to name but a few. And if we had greater availability of data that allowed the intersectionality of these factors to be considered, it would provide a greater understanding into male health and combination of factors that may exacerbate poor outcomes. And finally, future research will be required to look into the short and long-term consequences of the COVID-19 pandemic on males' physical and mental health. Thanks, Paula. Next slide. So in conclusion, there are only 4 countries that currently have a male health policy. And really reiterating what Paula said at the beginning of the presentation, there is a need for the greater implementation of male health policies to continue raising the profile of the health issues affecting males at the national and international level. But it is important when we think about implementing a male health policy that it includes a provision that allows high quality data to be collected, and this is to ensure that the accountability and the effectiveness of a policy at a later date can be evaluated. Next slide, please, Paula. Thank you. So in this presentation, Paula and myself have just provided a snapshot of the findings from our report and some of the key recommendations. So now we want to draw your attention to the 2 reports that we have put together that are available, where you can find more information on men's health. The first one is the report Men's Health in Numbers, which provides a comprehensive examination into men's health across the island of Ireland. And the report card is an infographic based on data from the Republic of Ireland. So the links to both these reports are provided here, and we really hope you will engage with these documents and find them useful going forward. Thanks very much.
Thank you, Paul and Aaron. And it just highlights, I suppose, the importance of having good evidence-based data, which is useful for us all going forward. And so can I thank you for drawing the report together, and I suppose speaking to all of us that we get a chance to see it in more depth. Can I now ask Colin to set up the next video from Peter Baker? Peter was chair of the Men's Health Forum in England and Wales between 2000 and 2012. He's now the Director of Global Action on Men's Health. He has coordinated the UK campaign on the human virus action, has achieved extension of the vaccination programme for boys, and is now working with the European Cancer Organisation on the same issue. In 2015, he completed an independent review of Ireland's national men's health policy, and this helped pave the way for the second phase of the development, the Health of Ireland Men's Action Plan. So, thank you.
Many happy returns to all my friends and colleagues at Men's Health Forum in Ireland. I'm very sorry I can't join you today, but I have a long-standing commitment to train men's health champions in the English county of Hampshire. But I'm delighted to have this opportunity to say a few words on behalf of Global Action on Men's Health, of which Men's Health Forum in Ireland is a founder member. I can also speak as the author, back in 2015, of the independent evaluation of Ireland's first national men's health policy. Ireland is one of a very select group of countries with national men's health policies. The others are Australia, Brazil and Iran. Austria was to have one, but a change of government put a halt to progress, hopefully not for too long. Ireland's two men's health policies are not perfect, of course. How could they be, realistically? But they nevertheless constitute a model which many more countries should follow. Many of their themes were in fact echoed in WHO Europe's Men's Health Strategy, published in 2018. The policy approach in Ireland has, thankfully, not been based on the traditional medical model. It takes account of the social determinants of health and health inequalities, proposed activity across a wide range of organisations and not just within the health sector. It was evidence-led and took account of a comprehensive consultation process. It takes a positive, strengths-based view of men and full account of the way men are shaped by the social construct of masculinity. Men's Health Forum in Ireland has played a central role throughout in the development and delivery of the men's health policies. It has also worked tirelessly, albeit with limited resources, to develop a comprehensive work programme and has taken the lead with organising a series of very successful Men's Health Weeks. Men's health would probably have got better in Ireland without any dedicated men's health activity, and that certainly happened in other European countries. But there's no doubt that targeted men's health activity can increase the pace of change and ensure that otherwise overlooked groups of men are included in progress. In that context, I would particularly like to highlight the very important work in Ireland with male rural workers. The focus on training through the Engage programme has also been of critical importance, as has the breadth of research on men's health issues. Of particular importance has been research looking at evidence of what works in terms of service delivery. The presence of a strong men's health lobby in Ireland has succeeded in pushing the issue up the agenda and acting as a catalyst for change. It has increased public and professional awareness of the issues, and it has also been an inspiration for those of us around the world who are also trying to make the case for men's health. It is of huge importance for us at Global Action on Men's Health, as well as colleagues in specific countries, to be able to point to what has been achieved in Ireland and to ask for similar action elsewhere. I also want to briefly mention the issue of gender-neutral HPV vaccination. As some of you will know, I was involved in a UK campaign to get the HPV vaccination programme extended to boys, to protect them against a range of cancers and to reduce the risk to women who have not been vaccinated. I want to thank the Forum for its fantastic support over the 6 years of the campaign. That support was not only in kind, it was financial, and the funds were generously given, even though your resources were finite. I'm delighted that we can now see boys being vaccinated across the island of Ireland, as well as in the rest of the United Kingdom and also increasingly in Europe. So thank you for everything you have done and will no doubt continue to do to improve men's health. And once again, congratulations on reaching the ripe old age of 21. I hope you enjoy the rest of your celebrations, and I now look forward to receiving my slice of birthday cake. Thank you.
Okay, can I thank Peter for those kind words, and can I now introduce the members of the panel discussion. Firstly, Noel Richardson, who will be the chair for the panel. Noel is Director of National Centre for Men's Health in IT Carlow. He is seconded half-time to the Health Service Executive to support the implementation of the Healthy Ireland Men's Action Plan. Noel is internationally recognised for his role as one of the authors of the National Men's Health Policy in the Republic of Ireland, and he's also the driving force behind its successor, Healthy Ireland Man. He is published widely on the subject of men's health and is respected for his evidence-informed and practice-focused approach to progressive men's well-being. Noel is well known and appreciated as a powerhouse behind all things to do with men's health in Ireland and indeed further afield. Can I then introduce Karen Galway? Karen is a lecturer in mental health in the School of Nursing and Midwifery at Queen's University Belfast. She's also a trustee of Men's Health Forum in Ireland. Her other roles include associated editor and with the Cochrane collaboration, co-chair of the Suicide Prevention and Impact Research Network for Northern Ireland, member of the Research and Quality Improvement in Forensic Managed Care Network for Northern Ireland, and member of the Belfast Protect Life Suicide Prevention Implementation Group. Can I also introduce Derek Griffith? Derek is Professor of Medicine of Health and Society at the Vanderbilt University in Tennessee, USA. He's also founder and director of a Center for Research on Men's Health within the university. Derek has led the development and dissemination of the Tennessee Men's Health Report card, which was the inspiration for our own men's health number card that you met today. He focuses on developing strategies to achieve racial, ethnic, and gender equality in health, and has been particularly active in applying the concepts of intersectionality, manhood, and equality in men's health. He is widely published and is a member of the editorial boards of the American Journal of Men's Health and International Journal of Men's Social and Community Health. Can I then invite Fergal Fox to join us? Fergal is the head of stakeholder engagement and communications with HSC Health and Wellbeing. He's worked in the health service since 2002. He initially worked in the Traveller Men's Health before coordinating Traveller Health in the Midlands region. He has moved on to become manager in health promotion and improvement in Dublin, Mid-Leinster for over 8 years. And he has a background in education, disadvantage, and the current role is focused on driving engagement and communication activities to support the implementation of Healthy Ireland in the HSC. Also, as part of his role, he's chair of the HSC's Healthy Ireland Men's Advisory Group. Can I also then introduce Lorcan Brennan? Lorcan is a training and development officer for the Men's Development Network in Waterford. In his work, he travels all over Ireland, facilitating workshops and presentations which promote greater awareness of men's health needs. He's highly respected for his work as a master trainer, mentor, and facilitator on the Engage National Men's Health Training Programme. And Engage seeks to help service providers provide a more male-friendly environment. Lorcan is also a member of the Men's Health Forum in Ireland Advisory Group. And can I also again introduce Paula Devi as a panelist? Can I hand over now to Noel?
Hi everyone, good morning. I have a Christmas birthday as well, so I'm delighted to share my birthday this year with a 21-year-old. So happy birthday to the Men's Health Forum. As Michael has highlighted, we've a really experienced and exciting panel this morning. I'd like to thank everyone who sent in questions over the last couple of days. I think there's nearly 40 questions have come in. So what we've tried to do is kind of synthesize some of those questions into more overarching, broader questions. So without further ado, I'll start. Fergal, I might start with you. Paul and Erin have highlighted some, I suppose, good news stories in the findings from both reports. Is there a sense that our work is now done and that we can afford to take our foot off the pedal at this stage? Or is there still a lot to do, do you think?
Well, absolutely, there's a lot to do. I think there's a danger of being complacent when we look at some of the improvements. But my reflection on them is that, you know, we've proven the case. Like I think, you know, 21 years ago, maybe a lot of people were fatalistic about men's health. And I know certainly when I began working with men, it was like, good luck to you. You know, it wasn't very positive. Whereas like we've seen and proven that, you know, men are more than willing to engage if there's a proper approach been taken. And huge improvements have been made. But certainly what's been highlighted in the report is a real call to action for further engagement. Like we know the context we're in. We can see some of the figures that are scary there in terms of cancer and the issues that need to be addressed in terms of the tobacco use, alcohol. There's so many lifestyle factors as well as the determinant issues. So I think it's a call to action in its own way. And the last, you know, what we've learned is that we can do this. So I think we should gain confidence in reflecting on the improvements that have been made. But given the context of COVID and where we're going to in the next couple of years, it's really important that we kind of arm ourselves and kind of head off into a different journey now. I think the battle is only started.
There has been some really positive culture change, hasn't there, underpinning some of the changes in statistics. So I think it really does behove us to look at that wider kind of cultural context of men's health and how that's changed and improved as well.
Absolutely. I think, well, that's what I was kind of trying to say, that I think that we've shown and men have shown, like, you know, culture change in how they've come to the, you know, participated so well in so many initiatives. Like when you look at the work been done in men's sheds, like men are leading that charge, you know, so that culture change needs to continue, I think. And there's some elements of our way of working around our health and wellbeing that are more challenging to address. And I think that's where we're coming to more challenging bits.
Great, thanks, Fergal. Turning to you next, Karen, is there any particular statistic or headline that grabbed your attention in particular from the report?
Thanks, Noel, and thanks, Paula and Erin, for the presentation of the information. It's really useful to hear it all presented that way, because there is a lot in the report, isn't there? And I suppose, you know, the part that strikes me that and interesting to hear Fergus talk about the culture change, because I think we have all this data on ill health, but as Paula and Erin highlighted, we have very little on good health. We have very little on well-being and living well. And I suppose, you know, we have to think of health as it's not just the absence of disease. We want to see people flourishing and doing well. So I suppose and we talk a lot in the Men's Health Forum about well-being and strengths-based approaches. So if anything, Noel, my call to action would be to improve our measurement of positive health and well-being, so that we now not only are changing the culture in how men's health develops, but we're actually measuring that and getting a sense of how well people are doing, and being able to see where people are flourishing, as opposed to being not ill. So that's my take-home message.
Paul, you might want to come in this as well. Are there any suggestions you might have as to how we could kind of benchmark those kind of measurements over time, or are there particular measurements that would be useful in that regard?
I suppose part of the problem is most of our statistics are based on people's interaction with health or other statutory services. So it's people who are diagnosed with something too little bit, not all diseases, that's a problem, or people who have died, or people who are in hospitals. So a lot of our data is collected for administrative sources. So we need to rely on things like surveys to include some of these measures. So we know that, say, within the UK, the ONS have developed a wellbeing measure. So I think it's really for those big government large-scale surveys, perhaps, to focus on some of the wellbeing measures that'll give us, or to ask people how they would rate their health as well, because how, you know, people can rate their health differently depending on, objectively, depending subjectively.
But I like Karen's thinking, like it's looking at health beyond the absence of disease or illness to something more holistic and positive. So I think it's a really important point that we begin to look at ways of tracking well-being and positive indices of health over time, rather than just looking at the absence of disease or illness or injury, which as you say, Paula, tends to be.
I think that'd be very welcome. Like, I suppose if we remain dependent on disease indicators, then we're always playing catch up, aren't we?
And it's an inherently kind of deficit approach to calculating health outcomes. Understandably, obviously, but yeah, that's something we need to kind of continue to work on. Derek, turning to you next. This is the first time the Men's Health Forum Ireland has produced a men's health report card, but this is an area you've been working on for many years now. Could you just talk a little bit about the context of Men's Health Report card that you've been involved with, and maybe comment on its impact and how it's maybe shaped policy or practice in the US?
Sure. Let me first offer my congratulations on your 21st birthday. Not you personally, but your birthday too. You might be older than 21, but that's okay. So the report card, you know, initially came to me and Vanderbilt from a state of North Carolina. And what they found was that it was difficult. There was a lot of data that while sometimes it was accessible and available to people, it wasn't packaged in a way that people to really understand it and make sense of it. And so they figured a report card was a much more intuitive way to help people to understand it, because most of them had been to some formal schooling where they got report cards and so forth. And so the concept sort of made sense. We've seen it really helpful in engaging with policymakers and educating policymakers, and for helping them to understand not just sort of the context of and the patterns of illness and disease, but as you've done in the infographic, in the report card portion, you know, highlighted where are some places that you might actually also intervene. And so I think one of the things that I really appreciate about the version that you've put together in particular is that you've highlighted not just things that affect, you know, or that would highlight recommendations for improving things like health behaviors and so forth, but you also get to improving access to meaningful employment, living wage, you know, quality health care, things that we may not think about as specifically gendered or as really necessarily even uniquely having to do specifically with health, but those factors nonetheless make a really big difference as it relates to men's health.
And I guess the real value is repeating this process every number of years so that you can track changes and improvements over time.
Yeah, so we tried to do it every 2 years. It was originally on off years with a women's health report card in Tennessee. They stopped doing the women's health report card. We then moved to about every 3 years. So yeah, I think it's helpful to have this be a regular thing, just because, again, there aren't usually regular sources that are this comprehensive, that are accessible and available to the broader public in a way that's easily digestible. So I think the sheer fact that you're able to then create something like this and then have it come out regularly, and then share it with the public and do events like this become really helpful as a way to benchmark success.
Great, thanks, Derek. Paula, turning to you next. There's a huge volume of data in the main trends report, so I'm sure you're glad to see the back of it at this stage. But just reflecting back on it, are there any kind of particular gaps in terms of the data that you're able to access, or any kind of particular challenges that you'd like to highlight?
A lot, but we've highlighted some of them already. It's very much taking that approach of it's about death, it's about diagnosis, but you know, obviously we don't have any figures on the people and the men who are living with particular conditions but don't have any connection with any statutory health services. So obviously so some of those figures we know actually are perhaps the tip of the iceberg, or they reflect a particular group. And we know that for some men there is a reluctance to engage with health services. So again, we need to take that into account. It was also very surprising the amount of that may not be broken down by sex into male and female. But again, as we highlighted, some of the data is collected for administrative purposes. So for Northern Ireland, there's quite a lot of data collected for the Quality and Outcomes Framework, and that's for a specific administrative reason. So whether it's male or female doesn't matter. So we found that in some of the issues, say perhaps in terms of arthritis and other conditions. So that's an important thing. And when we even look back now to March, and the huge call there was to try and get COVID data disaggregated in female. I mean, that seems so strange now, given that we know the different impacts that COVID has on males and females. But at the time, we didn't think that was an issue. So I think it's just really thinking about those, the disaggregation of data. And that was a lot of the challenges that we...
It must be a surprise, because going back to the first question that Fergal addressed about, is there still more to do? I mean, you would have expected at this stage that would be a basic requirement of any data set that would be disaggregated by sex.
I suppose it may be disaggregated by sex, but not publicly. That's the thing. So yeah, I should suppose probably say for the data access, so it could be that it is there, but if the reason that you're collecting data is to see how many people you've vaccinated, then perhaps it doesn't matter who the characteristics of those particular people. So so that makes a difference.
But I guess it highlights Derek's point about the value of something like report card to keep sex and gender on the radar and keep it as a priority in how we track things over time.
Yeah, and it also reinforces the need to then the complementary need for survey data as well. You can fill in some of those gaps. So things like the Healthy Ireland, the Northern Ireland Health Survey, things like Nicola and Tilda, the longitudinal studies of ageing, they're able to get into different issues, and perhaps in a more holistic way, because they're looking at social determinants of health and people's well-being and their other circumstances as well. So they're plugging a lot of the gaps that we weren't able to find.
Great. Lorcan, turning to you next. You've been very quiet there. Over the lifetime of the forum, 21 years, Ireland has seen dramatic cultural, social, economic, political change. Are there any kind of particular lessons we've learned along the way about how we should or shouldn't approach men's health?
There have been loads of lessons, Noel, I suppose, for all of us, and some of them have already been mentioned here this morning in relation to evidence and policy and practice. And when I look back across the 20 years, I suppose that's one of the key things that comes across, that we were so lucky that we started from a place where we had research. And I think Biddy is there, Biddy O'Neill. We look back across the starting out of looking at men's health through a lens in Ireland. There was the beginnings of looking and say it's really important to get the evidence base before we step out to do anything. And that was a really good starting point. And even going back to, getting inside men's health, that went on to become a national men's health policy. And somebody mentioned earlier as well about the importance of that policy being broader than a biomedical model, which was really, really important, and allowed us then to go on and start to look at how could you disseminate some of that kind of policy into practice and capacity building. I'm sitting here in front of a pop-up, which is for the National Engage Training Programme, which has reached literally hundreds of people, if not thousands of people probably at this stage, through being out across the country, which is an evidence-based training. And that was really, really important. And I think what Paula said there earlier on as well was really important, that the starting point of recognising the vast diversity of masculinities, that was a hugely important starting point. And we were able to celebrate the diversity of masculinities and bring that right through the heart of health and well-being was really, really important. And the other key learning, and it's going to be part of the future as well, the social determinants and social inequalities. It's not just all about men and behaviours. It has to be about a systemic approach to looking at how we, I suppose, mind ourselves and mind men as we go into the future. And I think in what has been achieved, and through the Men's Health Forum in Ireland, especially in the research that's happened along the way, that's always been part of the lens that we've had there. And Michael Lynch said at the very beginning, the importance of a strengths-based and not a deficit-based approach to
Just breaking up there, Larkin, a little bit.
the thing.
I'm going to come back to you, Larkin. Sorry, you're just breaking up. Terry, could you just come in there for a second? Are there any different lessons from the US, from your experience, or would you share the kind of things that Larkin has mentioned there?
Well, I think, very similarly, I think some of the things that even just between Lorcan and Paula, one of the things they mentioned was the need, now that you sort of know the limitations of the existing data sources, that you can actually start to think about, are there ways to incorporate some of the kinds of questions into some of those existing sources so that you actually do regularly collect this information. So it may not, so surveys are certainly one part, but are there ways when they're not sort of designed for those purposes to potentially incorporate some of these questions, even if it's a basic question about like self-rated health, I think Paula mentioned earlier, those kinds of very basic things, can they be incorporated into those kinds of questions? Or can they be, can you use those kind of sources for those kind of purposes? So really focusing on why data are collected is really important. I think the other thing that I don't want to miss about some of the initial things that you did in Ireland is use both qualitative and quantitative data. So the fact that you actually talked to men, in addition to using the initial, actual survey data, that you really got to hear from men themselves was a really important first step and a foundation for the work that you've done that is really unique in the world, really.
Yeah, Billy O'Neill always talks about the intersection of the kind of policy, practice and research partnership within Ireland. We've been really fortunate to have a lot of our programs underpinned by research and generating that evidence, both quantitative and qualitative. And I guess it's because we're a small island, it's been somewhat easier to do that, but I think it's given us some really rich insights into what's worked and what hasn't worked. Larkin, sorry, I cut you off there. Your Wi-Fi was just giving us, cutting in and out.
No problem, no.
Do you want to finish off anything?
No, I think what I said, I don't know what I said, what it was heard, but I'm sure what it was said, other people had said it as well there a few minutes ago.
Yeah, no, it was great. It was just the last few seconds. Okay, the last few more questions. Fergal, turning to you next, and notwithstanding your bias in this, because you started out in men's health yourself many years ago. What do you think has been the impact or the legacy of our national men's health policy? Is there anything that Northern Ireland could learn from this experience?
Well, it's difficult for me to say what Northern Ireland could learn, but certainly I think we've learned together, and it's certainly been agencies and supporters like the Men's Health Forum that have driven and been a kind of constant driver. And I think it has helped that, they're looking at an all-island approach. I know having the support from the Institute of Public Health over the years, having, yourself as a driver, Noel, and the likes of Biddy as a driver in the HSE, and having the Department of Health on side, I think we're able to create a very strong mandate with the policy. Peter Baker mentioned, a very strong consultation for the initial men's health policy. Like there was a group of people went around the country, like there was massive workshops. We wouldn't be able to host them now, but like there was massive workshops of every sort of man and woman around the country attending them, giving their views on what needed to be addressed for men's health. And there was a comprehensive, overview taken. So it really gave us a kind of an unbelievable ambition when you step back now and look at it, because it was very, very ambitious in its kind of cross-sectoral targets. And I think that work continues. We've taken some of it, we've delivered on some of it, and we continue to deliver on it in a way through the HSE Healthy Ireland Men Action Plan. But and in a way, I suppose that the Healthy Ireland, the cross-sectoral framework for health and well-being is taking some of that on board as well. It's looking at agencies like the Department of Education or Social Protection or Department of Justice, and saying, or Department of Agriculture in particular this year, and saying, how they can contribute to men's health and well-being. Like the Department of Agriculture is a good example down here this year, that have been a supporter of two of the initiatives that have been launched this year, On Firm Ground and Farmers Have Hearts. That's all with kind of groundwork that's been done over the years, and I suppose that's all kind of that's all feeding from having a men's health policy, having that kind of clear mandate and cross-governmental support. I think that's we're still kind of feeding off it, and it continues to kind of give us that kind of high-level ambition where we need to continue. Like it's so broad. There's so many different subgroups of men. You know, this work is never done in a way. One thing I'd like to reference actually, which I know I said I started working with Traveller Men, but when we had the International Men's Day recently, we hosted a webinar like this on men's mental health. But one of the biggest activators that day was Traveller Men. They really got on board with the Men's Development Network's campaign around celebrating men. And I thought that was a real indicator of how far we've come. You know, that you have a subgroup of men there that people are highlighting, but it's so challenging to address some of those really nasty social determined issues that Traveller Men are affected by. But you have them coming on board in a big way and showing real leadership from their own community. So I think that's, like, I'm not claiming like that was our win in the men's health policy, but that is still the kind of flow and effect from having research and having evidence and having that policy mandate mainstreamed.
That's a crucial point, Fergal, because I mean, I think the ethos in which the policy was developed, as you point out, was very much a kind of a holistic Ottawa Charter based framework. And again, Biddy O'Neill deserves a lot of credit for seeing it in that context. You know, it wasn't about looking at behaviours and adopting a kind of a blame approach for men. It was much more looking at the broader social determinants of health and how the key pillars of the Ottawa Charter would inform policy development. And as you say, that legacy is still there to this day. So it's as much about the principles and ethos as it is about particular policy recommendations or actions. Okay, last few questions. Paula, men have said to me over the years in focus groups that we're here for a good time, not a long time. And so, you know, that this kind of fatalistic attitude, I suppose, about, you know, living longer. We've seen life expectancy increasing. Is it enough to focus on life expectancy increases, or should we be looking at kind of broader measures of quality of life as well, do you think?
Yeah, absolutely. I mean, we know life expectancy is increasing, but it's really the quality of that life, as you say. I mean, that's there. In the report, we highlight two other measures, one of which is the healthy life expectancy, which is the amount of time people can live free from persistent ill health, and we also have a disability-free life expectancy. Those figures are highlighted in the report, and those can give a different sense of people's quality of life. But so we need to think about that. We know that our risk of particular diseases increases with age. So things like for some cancers, our risk increases with age, but then we know that treatment options and survival rates are getting better as well. But I often think that living longer is great as long as you're okay. You've got some financial resources, you've got the structural things around you in order to live well. And also then I think the 2020 has shown us really the need for social connections. And with the lockdown and shielding that people are doing in terms of COVID, I think we've just realised that the importance of having social connections for our mental well-being, which obviously impacts on our physical well-being and health as well, is just so important. So taking a life course effect, if we look at that, we can see that our whole life affects what happens. So we need to look at and think about the health and well-being of boys as well. So it's not just about men, it's thinking about increasing the health, the resilience, the physical and mental health of boys as well. That will enable them to live longer, and their outcomes now in younger age is likely to affect them in older age as well. So it's about thinking about living longer as we go through life, but also I think the social connections are just so important.
I guess that's really important with an aging population as well, that more people are growing into older age with healthier.
Absolutely. I mean, when we think that, you know, we used to say, well, older age, you know, in analysis we'd say 65 plus, but I mean, people can be living for another 30 years beyond that. People can be retired for 20, 30 years. So older age actually can be a third of your life. So we have to actually rethink what we mean by older age. And it's great that we are seeing so many more older men in our population, but we also then need to adapt our services and our interventions so that they are reflecting gender and masculinities, not just men, but also how they approach these particular services, how they approach help seeking, and the different circumstances of their lives as well.
Great. And Derry, turning to you next. Building on Paula's point there about healthy aging and getting more men into middle and older age being healthier, who are the particular target groups that we need to look at to ensure that this is a reality?
Well, I mean, you did a beautiful job, Paula and Aaron did a beautiful job in the report card, in the report, you know, highlighting some of those groups. So some of the men who are living in, as you characterize it, deprived areas, males, I think you talked about those with lower socioeconomic status. So it's just the folks who may be struggling for various reasons or for historical or contemporary reasons that may be grappling with different issues that we need to continue to focus on and pay attention to.
Great. We're almost up on time. I think we have time for just one or two more questions. Karen, if I could turn to you next. Is there a danger, do you think, that by focusing on men's health, that we could be accused of not prioritizing women's or children's health? What are your thoughts on that?
Noel, yeah, how best to answer this? So, the two things that I think of whenever I hear that question. First, it's not a competition. So, you know, men and women are different. There's no point denying that. There's not one of us could deny that, I don't think. And you know, the differences do impact on our mental health and our physical health. They pervade both areas of life. You know, they're not just due to some of the behavioral lifestyle choices that you know, always get sort of the first finger pointed as at lifestyle choices, but it's not just that. You know, it's culturally, it's socioeconomically, and you only have to look at the detail in the report on occupational groups, you know, to see there are health risks there in some of the occupational shape of our society. But you know, good health in males will also encourage good health in females, and good health in older men will encourage good health in younger men and in children too. So, I mean, you know, we live together, we work together, we parent together, we learn together. So the benefits of focusing on men's health, I think, you know, it's obvious that that will translate into benefits for females too. Of course it will. So that's how I would answer that question. And I don't think there's a loss to be had for women's health or children's health. I think there's only a gain to be had for an extra focus on men's health for everybody, and it should translate and filter through.
Great, thanks, Karen. And final question, I think we're just up on time. Lorcan, I might give the last word to you. What if you were to talk about your vision for men's health in the island of Ireland as we approach the end of 2020?
That's a nice last word question. I suppose for all of us, first of all, I think it's really important we build on the achievements that we've had. There's been a lot of, you know, we're talking about the celebrations of what has been achieved. And I think the vision for the future, especially, it's really important. 2020 will be remembered internationally, especially in Ireland as well, for COVID. But something really remarkable happened. People and well-being was put at the heart of politics and culture with intention. Really big change, really big move, super paradigm. And I think there's something in that model, and we shouldn't lose it in the discussions we have around where we go in the future. I think we need to continue for men's health to have the evidence base, to have the policy, to have the practice, to build capacity around engagement. They're really, really important. But especially post-COVID, I think it's really important that we keep looking at the social determinants. We also keep looking at the social inequalities and make sure, as we were saying earlier, that we track in anywhere that we see that people are being left behind, that has to be addressed in a systemic kind of way. That's really, really important. And the last thing I'd say, I think, is celebrate the cross-discipline kind of work that we can do together, because that's what makes a real difference. We're celebrating 21 years of MHFI. A really good model is International Men's Health Week. It was mentioned earlier on. We've over 90, 100 partners now that get together every year. We work together to develop the resources. We work together to come up with the themes. We work together to make sure that we disseminate the key messages across International Men's Health Week on an all-island basis, and we work together across those different disciplines, and it works really, really well. And I think we can play to our strengths in that way going into the future. We're going to need one another, and we need to work in that way to make a difference for men's health in Ireland. I know in the Men's Development Network, you know, we have a developmental approach to what we do, and this is the final word I'd say on behalf of ourselves. We've always wanted, I suppose, as well, to celebrate and call out ourselves into becoming our best selves in the world. What's it like to be truly a flourishing man in the world? I think that's a really important.
Well, look, that was a great way to finish there, even though
aspiration to have.
Sorry, yeah, look, you froze there again for a second. But you froze in the word flourishing, so what a perfect way to wind up the panel discussion. And if I don't finish soon, Colin Paula will never forgive me. So can I thank all the panel members for really interesting and stimulating discussion this morning. And just big shout out to Paula and Erin for doing a really fantastic job on both the trends report and the report card. Really super job, so well done. So we've heard from the Minister north of the border already. I'm not going to ask Colin to share with you a video from Minister Feehan, Junior Minister. That should come up right now. Thank you.
Good afternoon, ladies and gentlemen. I hope you're all keeping well. I want to begin by thanking the Men's Health Forum for inviting me to close this seminar. I understand my colleague Robin Swan, Minister for Health in Northern Ireland, welcomed you earlier, and this North-South cooperation is welcomed by my department and I. As a Minister at the Department of Health, I am very proud that Ireland became the first country in the world to adopt a national men's health policy, and that we remain a world leader in this field. Indeed, through the work of Healthy Ireland and the delivery of the HSE, Healthy Ireland Men's Action Plan, we have a strong network of partnerships and key stakeholders who drive and deliver initiatives on men's health every year with the HSE. I want to welcome the launch today of the Men's Health Trends Report and the report card, which gives us clear information on the health status of men on the island of Ireland. The report identifies the health challenges for men across the island, and in particular men from lower socio-economic groups, as well as giving us baseline data which will contribute to further interventions. I would like to acknowledge the Men's Health Forum for the contribution to the men's health agenda in Ireland over the last 21 years. Their ongoing contribution is significant and includes coordination of Men's Health Week, supporting the Engage training programme and the implementation of the Men's Health Action Plan. I am aware that they celebrate their 21st birthday this year, and I would like to congratulate all involved, but in particular Colin Fowler, whose passion and commitment to men's health is appreciated by everyone working in the area of men's health. I want to take this opportunity to remind you all of our recently launched Healthy Ireland Keep Well campaign, which encourages everyone to stay well and connected with others. As we are all aware, COVID-19 continues to challenge us all every day, especially the most vulnerable sections in our society, and I know that all of you who are attending today are very aware of this and that you're responding to the needs of these people in your own communities, and for this I am very grateful. Finally, I would like to thank the HSE for funding this project, and I hope the resources will be a valuable support to you all in your work. It only remains for me now to wish the Men's Health Forum every success for the next 21 years, leading the way for partnership working for men's health on the island of Ireland. Thank you.
Hello folks, and thank you for staying with us. It just kind of falls to myself now to just give a final few thanks. First of all, to everybody who joined us and likes it can stayed with us right throughout. That very little people moved away and a very busy life. I need to mention a few people, I suppose, without today wouldn't be possible. Again, he's not with us today because of his own health, but Ian Banks, our founder, to Owen Metcalf, that you might have heard from the Institute of Public Health, who way before there was Zoom allowed us to use the facility, so we were able to talk between Dublin and Belfast, to avoid a lot of the travelling. To Buddy O'Neill, who you may have seen or heard about. Buddy, it's really important for the advancement of men's health that we have champions who are willing to take forward the cause, and Buddy's been a stalwart, and a true champion of men's health before it was ever acceptable or even trendy to do so. You've already heard from Noel there, who was instrumental in the men's health policy in Ireland, and that has formed the basis of and allowed a lot of us to move forward in that. I need to thank all the presenters and all their expertise that is on today. Also, all those who have been involved in the organisations, the planning groups, the steering groups, the management committees, the boards of trustees, the advisory groups, along all those long 21 years. To Paula and Erin, again, for giving us another really good piece of work that allows us to go forward with confidence. I suppose with an evidence base that we already heard, that's very difficult. And he's already been mentioned by the Minister, and rightly so. But Colin from the front, who's been there, who's been in the background of all this today, keeping us running, who is a conduit often to the first contact point for many people who ring up the forum or are looking for the forum to give them advice and all stuff. And without us, really, we'd all be lost. He does an immense amount of work, and he doesn't like the accolades, but it's really important we acknowledge, because he has been a brilliant stalwart going forward to advance the whole cause of men's male health and well-being right to it. So again, thank you for listening, and we hope the report will help